Hey, I just published a ultimate book of practice questions. Let's do some questions together. My name is Huang. I'm an occupational therapist and certified hand therapist. And yes, we just published her. She thick. She got about over 800 questions, and they're all divided per how I teach my exam program. So I think that when you chunk up the topics, it's going to make it easier for studying. And um, so when you chunk up the topics, it makes studying so much easier. So the book is kind of broken up into hands, wrists, tendons, blah, blah, blah. We're going to go into tendons, right? So I'm going to share with you, this is what the tendon chapter looks like. And one of the things I do is I share lots of tips beforehand. Actually, I talk about how you can chunk up the studying, and then I give 3 major tips. So there's tips throughout the book. And then we'll go into questions. Now this book has questions, so you do all questions. It's about like 100. Some chapters has more than 100, but you go through those questions, and then on the back of that, it's questions and answers with a short explanation and either the chapter or the page to go to like go back through and look up the areas where you feel like you're not as strong, so that you can study that and make sure you can answer any question on the exam no matter what, right? So one of the major tips I'm going to share with you, which is at the beginning here, is I like to divide my tendons into flexors and extensors. So when I talk about learning hands first, it's because you already understand a certain amount of the anatomy of hands, and you understand how the biomechanics work, how the hand works, how it moves, and stuff like that. So when you dive into tendons, you're diving into the minutia of the tendons, the extensor tendons, the flexor tendons, all the little itty bitty details, and then you enter the protocols and then specific treatments for those particular problems. Now, if you have crush injuries, you have to think about tendons too, but you also have to think about fractures, and you have to think about ligaments, and you have to think about scarring. And so in this book, if you are familiar with my work, you know I teach the fast track framework, and it is in this book. So don't miss out. I'm going to include the link below. So if you're studying to become a certified hand therapist, this book is, going to be crucial for you to help make sure that you are practicing the practice questions. Okay. All right. So let's dive into some questions. I'm going to share my screen. So give me a hot second. We're going to edit this. Oh, nope. All right, here we go. Let's dive into questions. I'm going to read them out loud. And here's one of the reasons when I share this, I read it out loud. One of my past students, when I first started the exam prep program, one of the things that she told me that was really powerful is she's dyslexic, and she's got a certain amount of it, like a moderate amount of it. So she compensates by being an auditory learner. Now, when I teach, I talk often about being a tactile learner, like a kinesthetic. You want to touch everything. Some people are visual learners. Some people are auditory learners. And majority of us learn through multiple mediums, but some of us need a little bit more auditory than others. And so if this is for you, I hope this helps, even though sometimes I think I'm not the best reader, but all right, let's dive into questions for tendons. So I'm just going to share with you the first 5 of the chapter. If you want more, just buy the book. Patient presents with pain near the radiostyloid in the first dorsal compartment of the wrist. Which test would the therapist perform to confirm a suspected synostotic tenosynovitis of the tendons in this area? Oh, dear Lord. What a fancy word. Just say tenosynovitis. Anyway, choices. Etchkov test, Finkelstein's test. C is ECRL and ECRB test. It's the longest and the brevest. And then D is EPL test. Mark your answers. You can pause if you need and mark your answers, right? All right, we're going to go to the second one. Mark underwent surgery for a flexor tendon injury, zone 3. So, zone 3. E. Began therapy but is concerned about managing postoperative edema. When is the ultimate time for Mark to have his post-op dressing removed based on research findings? A. 24 to 48 hours post-operatively. B. 5 days post-operatively. C. 7 days post-operatively. D. 10 days post-operatively. Pause as you need. I'm going to move on. That way this video isn't going to be like 20 minutes long. All right. Question number 3. Which type of tendon repair is preferable to performing a sufficient safety margin? A. A two-strand repair. B. A 4-strand repair. C. A 6-strand repair. D. A 8-strand repair. Question number 4. A patient presents with difficulty extending the thumb index finger after a distal radius fracture. The therapist suspects tendon involvement and needs to differentiate between an extensor pollicis longus rupture and an extensor indicis purpus rupture. Which of the following correctly describes how to test for EIP rupture and identify EPL rupture? A. To test for EPL rupture, ask the patient to extend the index finger while keeping the other fingers flexed. EPL rupture is identified when the patient cannot extend the IP joint of the thumb and the wrist is in neutral. So the wrist is in neutral. B. To test for the EIP rupture, resist thumb IP extension while the wrist is in flexion. EPL rupture is identified when the thumb cannot extend at the MP. And thumb cannot extend at the MP joint. To test for EIP rupture, ask the patient to extend all fingers simultaneously while stabilizing the wrist. EPL rupture is identified when the thumb extension is weak but still present at all joints. D. To test for EIP rupture, resist wrist flexion while the patient extends the index finger. So resist wrist flexion while the patient extends the index finger. EPL rupture is confirmed when the patient can flex the thumb but cannot abduct it. You see what I'm doing? On questions like these, my cheat sheets are my hands, and I just go through the motions. I think that tip's in the book, but towards the back. Okay, last question. How is the extensor pollicis longus tendon function tested? A. By asking the patient to make a tight fist and extend the wrist. B. By having the patient give you a thumbs up while all the other fingers are flexed into a wrist. C. By placing the patient's pronated hand flat on the examining table and having them lift only the thumb off the table. D. By having the patient extend the MP joints while the IP joints are flexed. All right, those are the 5 questions, and I'm going to share the answers. All right, let's get into the answers, right? So number 1 was a testing question, and the answer is B, Finkelstein test. So the first dorsal compartment contains the APL and the EPL. EPB tendons. And to perform this test, the therapist grasps the patient's thumb in flexion and deviates the wrist in ulnar direction, producing excruciating pain in the first dorsal compartment. So usually we just have a short explanation and then the page number where you can find more information, or a chapter where you can find even more information. Number 2, patient underwent a flexor tendon injury. So based on research findings, okay, not about what you do, but what I do, and like, oh my God, this person, came in late. No. On research findings. And the answer is B, 5 days post-op. Number 3, which type of tendon repair is preferable to provide a sufficient safety margin? 6-strand is the key, right? Number 4, a patient presents with difficulty extending the thumb. So how do you test the thumb? And the answer is A. To test for the thumb, you ask the patient to extend the index finger. And then for the the EPL when the patient cannot extend the IP of the thumb with the wrist in neutral. So it kind of explains a little bit over here and tells you where you can continue to look further. So how is the extensor pollicis tendon test function? The answer is C, by placing the hand pronated, and that's how you're going to pronate, and then they lift up, and that's how you're going to see if that tendon is intact. All right, let me stop sharing. So those are the first 5 questions. Now, the way I do the questions is based on the HTCC's blueprint, which we have in here that I call my focus framework, and it just helps you to think through all the different types of questions. Now, you're gonna have some questions that you have to memorize, but general knowledge, you have to understand anatomy and kinematics and how all the tissue works, and then you have to be able to think through from a evaluation perspective. And so you saw some of those types of questions. Outside of those types of questions, there's prognosis and treatment. So in order to provide treatment, you have to know how to evaluate correctly, right? Because if you evaluate wrong, you're treating the wrong thing. The other thing is protocol is all about, it's not just about how, like a timeline, but protocols are like, how do you anticipate problems and how do you get ahead of problems? Because between protocols, when you find something that's wrong, when you treat and you find something that's wrong, you're going to go back to the protocol. So if you're treating something conservatively and you're like, holy shit, I found something, we now need to consider surgery. These are the things that you want to be thinking about as you're studying, because you just don't know what kind of questions are going to be in the exam. And one thing that we do is we try to mimic the exam as much as possible, just based on their blueprint and based off of clinical reasoning. It's like, it's what you do. It's literally so much about what you do in the clinic when you are working where you don't have all the information. I am in a private practice. I don't have access to everyone's information. And people come into me and I have to be able to decipher like what's going on, what do I need to do, what do I suspect, and like I just had a flexor tendon injury. He's been with us for a little while, but just knowing it's intact, what's going on, why is it stuck? Obviously a lot of scarring, but then from a treatment perspective, what are you doing? You have to do scar stuff, you have to do tendon glides, like you might have to do splinting, what kind of splints, and then at what point when they're stuck do you recommend surgery, and what are the surgery implications? These are the things that we do every day. We're making little micro decisions. Sometimes we make big decisions, but we make micro decisions and we help our patients so that they can get the outcome that they want. For the exam, when we're doing practice questions, or when we're studying and then doing practice questions, the practice questions just allow us to make us think and critically analyze all the information as we, technically should know it, not because the doctor told us, not because someone wrote in a protocol book that everyone has to be done by, 3 months. And in your clinic, like, holy shit, my patients are staying longer, they're getting stuck, we have different issues, some people scar more densely, and not all surgeons are created equal. Let's face it, right? You have some surgeons that are great, they do great surgeries, and then you just have some, they're butchers, right? And so, yes, from a textbook standpoint, when it comes to tendons, yeah, like ideally it would be so great if everyone did the wide awake approach and minimize edema, but sometimes you working in a place where the surgeon doesn't do that, or the surgeon sucks and everyone comes out swollen like a balloon, right? I mean, let's face it, there's a lot of factors to it. We just have to understand what they are so we can make decisions around it. This is critical thinking 101, critical thinking 101. And I think it's really important as therapists for us to acknowledge that's what the exam is testing us on. All right, let me know if you enjoyed doing questions with me, because maybe I'll do some more. We have other chapters in there and I'd love to share it with you. So if you like this, or if you have questions, let me know. If you want to buy this book, I'm going to include the link below, and get it when you're ready. All right, thanks.